all of this. From here, all the way, turn yourself. All right, all the way to the back. So I do not want to hear that you cannot, no, stay. I don't want to hear that you cannot find the kidney until you have scanned from here. This, all of this. I mean, not so low, but all of this from here to the back, until you have scanned this whole entire area, don't say that you cannot find the kidney, okay? So the way that I start, right, I'm gonna show you the way, go normal. I'm gonna show you the way that if you pick up the Betty Tempkins book, it's gonna show you like this. Breathe in as much as possible. All right, so the Betty Tempkins is gonna show you like that. All right, it's gonna show you like that. To get the kidney in its long axis in oblique plane. Oblique plane means that it's at an angle. All right, can anybody tell me physics-wise, because I covered this with you already, why is this not good? Anybody describe to me what a specular reflection is? Specular reflection. Specular reflection, specular reflection, specular reflection. You guys remember I told you a specular reflection is when you hit at a certain angle and it comes back at the same exact angle, right? So if I hit this, boom, coming back this way, not coming back straight to the transducer. It looks really nice because you're gonna scan him and he's gonna have everything nice. So, you know, even if I have an oblique angle, it still looks good on him. But in other people, you're gonna notice that this angle is not gonna be that good for you. All right, and also it shows that your physics is not that well, because if you can get this organ at a 90 degrees means you hit at 90 degrees, it comes back at 90 degrees. So physics tells you that if you can get the kidney at 90 degrees, it's better. All right, so that's how the Betty Tempkins will do it. And then the Betty Tempkins will tell you, okay, measure like this, which is fine. It's fine to do that. All right, I don't like to do it that way. All right, if you do it my way, once you go to a place and they see you the way that you're getting it, they're automatically gonna say, damn, this person not only knows how to scan a little bit better, I mean, of course you have to perform the whole protocol, but this person also knows their physics. So we're gonna put the patient on left lateral decubitus, same position that we did on the pancreas. If you want, don't go all the way so you can see. All right, and I'm gonna go in a coronal view, I'm gonna go from coronal and back if I have to use the back. Now, the kidneys are not completely straight in the body. The kidneys are angled or this way, usually this way. So a lot of times you're gonna see that I have to do this or I have to do this to open up the kidney. All right, but I'm gonna try my best to get the kidney straight instead of angled. You see, I still come coronal and still angled, so I'm most likely gonna have to come towards the back. All right, okay, you're gonna have to move all the way. Move all the way, and then I'll show you the image.
Coming to breathing.
Wait, outside. All right, breathe in. All right, do you see the kidney completely straight there? All right, breathe out. All right, so this is by far the best way of getting it. Obviously, I know you're gonna say, all right, but it looks nicer. Doesn't really matter if it looks nicer. This is more accurate to get it like this because physics tells you. All right, so I have to try my best to get the kidney. You can use right kidney side, right kidney coronal, I don't care. All right, as straight as possible. Okay, not in some people you can't get it that straight, but in like 90% of the people you should be able to get it this straight. All right, at a 90-degree angle, and then I come measure. All right, if you have this, you use it. If you don't, then you can just measure normally. I'm gonna go length. From superior, what I'm seeing is this. Is everybody noticing that it comes over here? You seeing the same thing? So I'm going from superior pole to inferior pole. I should fix this a little bit. Notice the difference. Notice how more accurate. If you noticed when I did it oblique, the measurement was coming like 9 centimeters. That's what it was coming out. Now it's coming out close to 11 centimeters. It's coming out more accurate. The average kidney usually is 11 to 12 centimeters, even though anywhere from 9 to 12 is completely normal. But the average kidney is, 11, 12 centimeters. Okay, so notice how I went 90 degrees. Yeah, it kind of looks a little darker here, and in the other one it looked a lot brighter, but notice the measurement here, and I'll show you the other measurement on the other side. So I come here, I done my long axis measurement, and I do my AP measurement, which is height. All right, so I go from there to there. Okay. All right, so one with measurement, one without measurement on the same image. Don't give me two different images. Notice how my focus is at the level of the kidney. Okay, now I'm going to show you. We're going to go back and we're going to get this beautiful kidney that we got over here. Trying to get it as long as possible. And let's do this. Isn't the kidney a lot smaller there? Yep. So it looks nicer, but it's more accurate when you do it the other way. Because once again, you're seeing more of it because of the angle that you're using to hit it. Okay? So I'm basically going to do my first three images there. The image with the regular long axis with measurements, and then with, I like for you guys to do both. Color Doppler and power Doppler. For real, in a protocol, you're not going to use both of them. You're only going to use one. But I like for you to use both, for you just to learn how to use these two buttons. So I make all of my, I make all of my students use both of these techniques. But for real, it's usually one. Breathe in. Notice how I have to angle. You guys noticing that I have to angle to open this up? And damn, this one looks better than the one I took earlier. Let's see if this works. Sometimes it works, sometimes it doesn't. It's working right now. Oh, shit. You're gonna cover the whole kidney and look at the amount of, look at that. This is what I call like the fingers or the trees. Okay, so this is what I call like the little fingers going into the kidney. This picture is taken for perfusion. If I were to ask you, what is the whole point of this picture? For perfusion, perfusion is the blood that's entering into the kidney. Can we say there's a lot of blood entering to the kidney or a little bit of blood entering to the kidney? It's a lot of blood entering to the kidney. When you do this, this is the most common one that we use, because this one, it doesn't have different colors. It's the little one. All of the machines have it. It doesn't have different colors, but this one is more sensitive than the color Doppler. So the reason why I like to use this one, and this is the more popular one, is because I'm trying to put color in really small vessels. So if I'm trying to get color in really small vessels, do I want my machine to be more sensitive or less sensitive? More sensitive, because it's really small vessels. So that's why this is the more popular one. But anyways, I want you to do both of them. All right, go back. Obviously, you should not be taking off the probe 100 times, because now what? I'm gonna have to find the kidney again. Versus if you don't do that, I breathe in again. If you find the kidney in its long axis, all right, freeze it, measure it, power Doppler, did my power Doppler, freeze it, save it, then turn on my color Doppler. All on the same thing. You see how fast I did that? Okay. You see how fast I did that? So I have to do that because I'm talking to you guys. But that's just going to make it forever. All right. Literally, I did those 4 images in like 2 seconds. You know, 10 seconds, let's say. All right. So don't take it off. And especially when you find the position back here and you take it off, another 5 minutes to find the same exact position that you found. Now, in the right kidney, I like to use both prone, coronal, and supine. On the left side, you're going to notice that it's all going to be coronal. It's all going to be right here. But if you have more space to find it, use everything. Use everything. So my next views, so I'm going to use that position. In some people, you're going to get that straight kidney right here. In some people, you're going to get that straight kidney in the back. All right, now go supine. All right, now the next images that I'm going to take, when doing the right side, I like to do them supine. Because I don't have to do measurements on these pictures. I don't have to do color Doppler, so I can care less about the 90-degree angle anymore. All right, so I'm going to come supine view, subcostal, just like when you would take the picture of the liver and the kidney. All right, breathe in. All right, so I'm going to open up the kidney as much as possible, and these are called the lateral images. Lateral image means I'm going to angle twice to the right. There's no specific how much. You get the kidney, angle once, angle twice. How do I know that you're moving? Because I'm going to see the kidney smaller and smaller. Okay, watch. you always have to find the biggest portion of the kidney first and then angle. Don't just come over here and then start angling. No, find the kidney, breathe in, find the kidney, try to open it up like that, and then angle outside. That's lateral. I angle one outside once, freeze, save. I angle again, freeze, save. If I keep angling, there's no more kidney. All right, so notice how those images, how I can tell if you did it correctly, because I'll notice, look at the size of this kidney, look at the size of this kidney, right? You saw I'm getting smaller. Now we're gonna do the same thing, but medial. We're gonna angle inside. Once again, it's not go and medial, no, it's go, open up the kidney, and then angle medial. All right, it's medial, not mid, medial, M-E-D, not M-I-D. Okay, so I'm gonna go same position. I'm gonna open up that kidney. I'm just gonna angle, and remember your angulations are small. All right, I'm gonna open up that kidney, angle a little bit inside, freeze, save, and a little bit more inside, freeze, save. I'm only seeing a little piece, so it was like I saw the kidney this big, and then went like that, bam, bam. And notice I didn't do this medial, medial. No, I did medial, medial, lateral, lateral. Very small angulations. You only have a kidney this big, so it's not too much you can angle. And two medials.
Do you have to do a diaphragm or doesn't matter?
Huh?
Do you have to leave a diaphragm there or doesn't matter?
No, yeah, diaphragm. Okay.
Doesn't matter.
I mean, you're gonna always show the diaphragm, because if you cut off the diaphragm, you're gonna cut off the kidney. But I'm not looking at that. Okay. All right. Now what I'm gonna do? Look at what I'm doing. I'm gonna open up the kidney. Once I open up the kidney, I'm gonna get the probe and I'm gonna move up. Now, when I move up, I have to make sure that the kidney did not get smaller while I was moving up. The reason why I'm gonna move up is because I'm gonna center and I'm gonna show the superior and inferior poles. So I'm gonna move upwards to show the superior pole of the kidney, and then I'm gonna angle downwards to show the inferior pole of the kidney. But you have to have the kidney open. I'm gonna show you guys, I'm gonna show you the right way, and I'm gonna show you what you guys are most likely gonna do.
Yeah.
All right, breathe in. I opened up the kidney as much as possible, and I angle upwards to show superior pole in the middle of the image. All right. Once again, breathe in. I open up the kidney and angle. You see how when I'm angling down, it got smaller? But it's okay, I'll open it up again. You see, now it's opened up. And I angle down and I see the inferior pole. What are you guys gonna do? You're gonna do this. You're gonna get a long axis. Is once you start moving up, you start doing that. And then the kidney, and you're like, oh, that's the superior pole. No, it is only the superior pole if I see the long axis of the kidney. And then you're gonna do the same thing. Breathe in. You're gonna get it, and you're gonna start angling down, and you're gonna start and you're gonna be like, oh, right there. No. How can I tell? Because I'm gonna be able to see the darkness of the kidney and the brightness of the kidney. Okay? We're done with sag. We go to transverse. Superior. So the first thing I'm gonna do is I'm gonna find the middle of the kidney. How do I know that I have the middle of the kidney? You see a vessel going in right there? All right, be done. Remember we had the hilum of the liver? Well, this is the hilum of the kidney, where the vessels are going in and out of the kidney. That is considered mid. Wherever the vessels go in and out of the kidney, that is in the middle, not medial, mid. So I always have to find this one to know how to go angle up and down. So, once I breathe in, once I find the middle of the kidney, I go up, and I come superior. I'm starting all the way up, superior. Then I come down a little bit more. Another superior. Then I go down and I find my mid image. Find my mid image, take the image, measure, and that's the last measurement. Oh, shit. Measurement is always 90 degrees to the hilum. The hilum is coming in this way. I have to measure this way. All right, so I come from here to here. Less than 6 is considered normal. All right, once again, notice how I'm taking off the probe. Notice how